Dear audience, welcome to this show Power Chat. In today's episode, we are discussing about healthcare services with particular focus on the activities carried out by Shalby multi-specialty hospitals based in India. Joining us today is Dr. Bharat Gajjar, Director of Outpatient Service Worldwide. Please allow me to welcome him. Welcome to this show, Dr. Gajjar.
Thank you.
Let's begin with your observation about this country, Nepal.
Observation one is the attraction was the Lord Pashupatinath temple, and the people whom I met for the first time, they are caring people. Love and affection that they have given, that has brought me here again.
Well, Dr. Gajjar, you have been into the hospital services, different issues. You are specializing on joint replacement. And you are working with a chain of hospital, Shalby multi-specialty hospitals.
Yes.
How do you see the state of health and medical services in this region, the countries like ours, Nepal or India or some other countries in Southeast Asia?
So, health is a prime requirement of anybody in any part of the world. So when it comes to services, so for good healthcare services, you need to have good doctors. That is number one. Then good infrastructures, good paramedical staffs, and the most important part in the medical field is the personal touch. If you take care of patients as your relative, they can get better faster. So that was our motto when we started in 1994 with 6 beds nursing home, and nothing but the faith of our patients in us has brought us in 2020. We have a network of 11 hospitals, multi-specialty. We started with a joint replacement, single specialty. Our brand is single specialty, but let me be apart from knee, we have to take care of patient as a whole. And with that concept, we started in 2005 a multi-specialty in Ahmedabad. Gradually we expanded, and we are the first people to take care of patients once they are operated. We started follow-up clinics in each part of the country and abroad also. So for better treatment, patient doesn't mind going anywhere in the world. But what about follow-up? That's the only thought that they come in their mind. So we started that concept. Once they are operated, we go to their doorsteps and take care of them post-operative.
What are the major changes occurred during these all years, 94 and now?
94, when we started in knee, there was no awareness. People used to accept old age. They think now we are old, we don't need to walk because there was no facility. Nowadays, current scenario is, if you divide your lifespan say in 3 stages, young age is childhood, young age and old age. When you have to enjoy, you are suffering because of disability, being in house only. So we need to help those people. The only inspiration for Dr. Vikram Shah to start this is, his grandmother suffered from osteoarthritis for 20 years. She was in bed, in tears, all the days, cursing for death every day. He could not see that tears in his grandmother. So he thought, let me do something for the medical fraternity for the old people. And then he studied in India, had experience abroad, and came back to the country. We want to serve his country people. He came back and we started.
Really motivating story, Dr. Gajjar. Before I come to your areas of work under this chain of hospitals, I would like to ask you about the access to medical care, that of the general people. Do you think, you have been into medical field for a long time, the medical service field, do you think that the hospital services at this time in our countries is accessible, affordable to people who want to have treatment of any kind?
Accessible, there are a lot of accessible hospitals everywhere in the country. In India, I don't know much about Nepal, but important second question is affordability. When it comes to affordability, I will tell you one thing, there is no planning for health from anybody. Everybody will plan for say holidays and everything, nobody plans for health. So first of all, we have to create awareness about the prevention of diseases. Prevention of diseases like heart, hypertension, blood pressure, hypertension, blood pressure, osteoarthritis, to prevent osteoarthritis, and other. So many things are preventable, but we don't take care. That's why it comes faster. So basically, we have to have some awareness programs in the social organizations like NGOs. We have to have some awareness programs. But what has happened nowadays? People think when we do this awareness, people think that doctors are doing business. No, I always tell. Okay, there is a scenario. Okay, patients are afraid of doctors, and doctor afraid them. No, we try to come closer to the patients. Let's be a friendly environment. So your patient's comfort also will increase, and my responsibility also will increase.
So do you think that people are aware about their health?
People are not now, gradually it is. Yes, when we started in 26 years back, it was not. Now even village people, they have some medical facilities. They go to gym, they do all the walks and everything. You see nowadays in the gardens, the old people keep on walking. You see on the roads also they keep on walking. So if you walk, every system works. Your brain works, your heart works, your body works. Walking is important. People think that it is good for knee. No, it is for body as a whole. If you don't walk, everything will be working at a lower level.
What are the key services and interventions within your hospital, and how are you collaborating with the different agencies and organizations working for the promotion of the hospital access, hospital services of Medicare?
Basically, when we started EVZ, that we thought that it's a requirement. So we wanted to create infrastructures when the patient is in. So he should be totally cured once he goes out of hospital. For anything, we don't have to send him like here and there. So we started with that. We have all the facilities, like start from, I would tell you, you should start from hair transplant, the neurosurgeries, interventional neurology, endovascular, eye surgeries, glaucoma, which is very common in old age people, then ear, nose and throat, dentistry. People forget about dentistry. The most important, how much, no amount of money you have, you cannot eat, then you are not happy. So dental awareness, then comes heart, bariatric, liver. We do renal transplant, liver transplants in our hospitals, and knee replacement, hip replacement. The body as a person as a whole we take care, and we started a multi-specialty hospital first, and then we gradually started follow-up clinics, and later on when we are established, we have established 11 hospitals across India, and we do have so many patients coming from abroad also. So we are coming in a big way in some countries also, other countries also.
How are you working with the hospital care or healthcare organizations in Nepal?
Still we have not worked out. This is my first visit in Nepal as far as the medical hospital part is concerned. First visits were only social, but we have so many patients coming from Nepal to Ahmedabad. I would tell you more than 500 to 1,000 people we have operated from Nepal. Virat
What is their response?
That's why they are coming. Our brand ambassadors are our patients. I tell you, in first year we did 14 surgeries. That 14 has given us to 140, then 140 has taken us to 140. And I will tell you, we have done more than 1,10,000 replacement, which is highest in the world. Highest in the world.
You said at the beginning that we started with knee replacement, single facility hospital.
Yeah.
What are the key facilities at the moment? You have expanded your hospitals to 11 branches in India.
Everything.
And working around.
Everything, because old people have so many problems. As far as knee is concerned, it's okay. But heart, lung, liver, they have all the age-related problems. So we have to take care of them. It's not like that you have heart problem, go to cardiology. No. We sit on to it. We take that patient should go out of the hospital smiling with no problem. Any other problem, we take care of them. So that is the most important part, and a personal touch. I tell you, the personal touch in healthcare industries makes a lot of difference. Patients are lost sometime in corporate hospitals where we give personal touch, and that's the reason. So one happy patient 10 patients more. That's
also,
the only.
Dr. Gajjar, there is criticism that the hospital services are not affordable and services are not accessible. to one who wants to, good treatment across? What you have to say about that?
As far as affordability, I tell you, like India, we have so many economical stages. See, I tell you one thing, if you take a train, there are 10 types of trains available, super fast, fast, local. In that also, there are 8 classes, unreserved, 3 tier, 2 tier. Everybody is traveling same train. But question is, if you want facility, if you want better treatment, compromise with facility of say other things, stay and everything. Then we take care of everything. Till today in my hospital, not a single patient has gone out of my hospital because of money. But nothing is free in this world. I always tell, even water that we are drinking, we are paying tax for it. Only air is free. Even if you put it in bottle, it is chargeable. So healthcare industries, affordability, yes. There are different categories. We have different classes also. For poor people, the middle class, upper middle class, rich people, we have all the facilities.
Do you have any package for one
Yes,
who
yes,
could
yes.
not, afford it?
Yes.
How do you support or help them?
That we can read their face. Some people say, I want to get it done by you only. If you say, I will lie down on floor, but I want to get operated by you. It means he has faith in doctors. He is not a bargaining person. And I tell you, poor people never tell that they are poor. They never tell. They will think this is not my place. But we have opted so many patients, just they keep the implant charges and we have treated them freely. So we do that part also, CSR activities. We have some trust, so we accommodate that also. We have special ward for them. So for affordability is not an issue, but cost should not be at the cost of services.
Well,
Any patient would go for the best, then cheaper. So treatment has to be best.
Well, what is your observation about the areas that you are working, especially that of the old age patients?
Yes.
You started with
Yes,
the
yes,
knee
yes.
replacement. What are the key problems that patients usually come to you, and how are you providing them with the, as you are claiming that you are best facilities?
Not we are claiming, people are saying that people have given us this status, not I am claiming.
Do you have any specific case study or story to tell us?
Yes.
Could you elaborate
I
it?
tell you two examples. Why there is 99 difference between 99 and 100. We operated one patient from UK. Her name was Padra Manik. She was operated in UK for knee replacement 4-5 times. She had so many problems. Ultimately, last option was to amputate her leg from thigh. So can you imagine a condition of her husband? His wife was to be amputated. He came to us. We operated upon her. He kept her for 1 month and she went walking. Their cost factor was not important because in UK he was treated free. But here he is going with his wife walking on her leg. Second, one person I have seen in Nairobi is 24-year young boy, Dominic. He was having malignancy in the knee. His leg was to be amputated. When I visited him in Nairobi, his father was in tears. My son is going to be amputated, his leg is going to be amputated. Sir, can you do anything? I said, keep faith on me, come to India, we will try our best. We can try. And we operated upon her, we have done 12 surgeries. And he went walking with him. And today after 6 years also, he is walking. When I visited last time in Nairobi, he was just crying. But that tears was of happiness. My son is walking now. So this is what a medical fraternity can give you. Boy is all right, but happy is his father. So this is what a doctor can give you. And I always tell that don't consider doctor as a god. We are not God.
Well, interesting stories.
We have been given a knowledge by Almighty. Okay, go to earth and serve the humanity, and we are doing that.
What are your suggestions to people for a prevention of any type of diseases relating to replacement or other?
Likewise, I can tell you about my subjects. Like osteoarthritis is not a disease; it's an aging process. Everybody is going to have cataract. Everybody is going to have a graying of hairs. But how when you can prevent it? At the time which it is going to come, say about 60 cc, you are going to have it. But it should not be at 45-50. So first criteria is overweight, because your weight also comes on the knee. So when we stand, we are loading 3 times of our body weight in your knee. So if you reduce your weight by 5 kg, you are offloading by 15 kg. Sitting on the floor, most common cause of osteoarthritis in this part of the world is sitting on the floor, doing pujas on the ground. Because while getting up, you are putting more pressure on the knee, and standing for the long time. Because if you stand for a long time, it is a constant loading. When you are walking, it's a smooth landing and smooth takeoff. So there is always cartilage regeneration, and the chances of osteoarthritis coming at earlier age, you can delay it.
Well, how are you collaborating with people and organizations, creating awareness among the people? You are here for an orthopedic workshop.
We do minimum 3-4 programs in a month within Gujarat, within country and outside country also. We do some awareness programs in NGOs, prevention of heart diseases, prevention of osteoarthritis. And if it happens, what to do? Important is patients are confused when they have any problem, and they are not being properly guided. What to do, that also one should know. Prevention, yes, that is the first part. But if it happens, then what should be your criteria? Likewise in knee, why it is to be done, everybody knows. Then where is most important, where all the infrastructure has to be there. Likewise, bypass surgery cannot be done in a normal routine setup. For you have to go high-end surgeries where all the facilities, all the other backups are there.
How are you preparing yourself to deal the medical crisis? There are often stories in media of different hospitals and Medicare centers not appropriately treating or providing with the treatment to patients coming to their hospitals.
I always tell doctor has to be honest first. He should satisfy himself, I have done my best. We tell all the things beforehand. In replacement we say these are the chances of complications. This can happen. It will not, but this can happen. When you know what are the complications, then you are prepared for it. So we never misguide the people. What happens whenever doctors are trying to sell surgery, I always tell, let patient buy it. When you try to sell the surgery, you will say so many things upfront, but when patient is buying it, he will ask you 20 questions. Once he is satisfied, then only he will undergo surgery. So best is, I always tell, time spent before surgery or before treatment with patient is more important than time to be spent after surgery or after. Because let patient ask all the questions. Once it is clear, then he will not ask any questions. Then your responsibility increases. I always tell, try your intelligence in identifying a good doctor. One day you have to go to a doctor. So rather than blaming them, find out a good doctor and then put a faith. At one point you have to put a faith on someone. We are clever enough. If you are going to buy something, you use your this thing. So find out a good doctor, then ask him.
What do you have to say about the criticism on hospital services, that sometimes hospital service providers are engaged into more business interest?
I tell you, people have started thinking that is a business. This is, to me, my experience of 40 years in this is, it's question of satisfaction at the end of the day. And satisfaction doesn't come by money only. By money only. If we see my patient going out of my room with a smiling face, then that's my earning, I would say that. And money follows after work. You don't have to work after money. You do your work, then money will follow it. Because patients will come and happy patients will send. If you do something, say business part, then that patient is going to send anyone. So again, that is not the right way. honest work, dedicated. This profession is based on honesty, dedication and ownership. Honesty, dedication, ये मेरा काम है. This is my job. Ownership, this is my patient. He is my mother, he is my father, he is my sister. Then you can't do anything wrong with them.
Do you see that principle applies to the hospitals these days?
I tell you, we concentrate on our field only in all the hospitals. That's the reason wherever we start hospital, we train the doctors at our hospital. So we want our environment also to be transferred to that area. Suppose if I start hospitals in Nepal, then we treat Nepali doctors to our country. Let them have a feel how we have grown, how we treat the patient, how we treat our parents. Then when they come, then the environment will be totally different. And we have full-time doctors. We have no visiting doctors. So there is no vested interest of any doctor. They are within the hospital. Availability also is, anytime any problem, all doctors are within the hospital. You don't have to call them. I am here, it will take 2 hours. No. We have full-time doctors wherever our hospitals are.
Well, what are the differences in quality in the countries like ours? If you have to compare the medical services provided here in Nepal or in India, if you have to make comparison, where are we?
I don't know much about Nepal, but I can see that if the trained doctors are there and the facilities are provided better by the organizations, government and semi-government people, doctors has to be trained in a proper environment. We are not in hospital business only. We are in an education transformation also. Every month we train more than 5 to 6 doctors from all parts of the country. Few Nepali doctors were also there at my hospital few months back. Bangladeshi, Philippines. We do education, teaching. We have done live surgeries, Uzbekistan's government hospitals. We want to teach because there is a study that in coming days there will be epidemic of osteoarthritis because of the population and long lifespan. So you will be requiring lot of doctors. So we are in training also. Till today we have trained more than 300 doctors. More than 300.
How do you analyze the quality of medical education in your areas?
It is always better. Education is almost more or less, I am telling you same. It's a
Are universities producing the human resources or manpowers that are actually needed to the hospitals?
Or there is something so many private medical colleges also has been started, because when there is lack of seats, then doctors don't get admissions. So they have started private medical colleges also. There are enough doctors now, and it is a requirement of community because population increases, so doctors will be needed.
My question was on the quality of education in medical sector.
Now it is improving. It is improving because the people, like we are trained, so whatever we do, that will be the best.
Well, there are many interesting issues you are sharing with us, but we are coming to the end of the show. Do you have to say to our audience anything very quickly?
I tell you of my subject only. Okay, I will give you a message to the young people. Your father has hold your hand and taken you to school for 6 years. Don't let them suffer in the last days of their life because of disability. There is a possibility, and that was a mission of Dr. Vikram Shah, my chairman. Not a single old man should have his stick in his hand and tears in his eyes because of disability. That was his mission. You have been able to successfully fulfill it to make them happy, moving around the gardens and enjoying their life.
Well, Dr. Gajjar, it was a pleasure talking to you. Thank you very much for joining us.
Thanks.
Dear audience, time now to wrap up the show. Keep watching us. See you next week. Namaste.